Hi folks, Christian Brindle here with Brindle Insurance Services, and we are in the Medicare annual election period. And in this video, I want to share with you 3 tips on how you might be able to get your Medicare prescription drug costs down in 2024. And it might not even involve your insurance all the way. So let's just jump in. If you've been on Medicare for an extensive period of time and you take a lot of prescription drugs or you have high prescription drug costs, you may have noticed that Medicare prescription drug coverage can be a little painful, especially when you get into things like the donut hole or the coverage gap, and maybe you have a deductible on your plan that applies to expensive brand names, and your prescription drug costs can sometimes be in the thousands. This has always been a problem with Medicare prescription drug coverage ever since it became a thing in 05-06. Okay, so what can you do? Well, there's 3 things in my estimation that you can do to kind of combat these high prescription drug costs and get your prescription costs down and have some more money that you save in your own pocket as a result. Okay, so these are the 3 things that I believe that you should be aware of going into the new year in 2024. The first thing that you should be looking at is patient assistance programs. Patient assistance programs can best be thought of as manufacturer programs. These are programs that are put out by the pharmaceutical manufacturer company, the company that makes the prescription that you are on that's causing you so much grief. So if you're taking a tier 3, a tier 4, a high cost brand name prescription, maybe it's a specialty drug of sorts, there may be a patient assistance program available that you can qualify for in order to get your prescription costs down. Now, sometimes this is going to depend on the manufacturer. Some manufacturer programs are not available to people on Medicare. Sometimes when they are, it has to be an income parameter. It has to be to where the cost of the prescription is going to be a certain percentage of your yearly income, but it's worth looking into. One thing you can do is there's a website known as needymeds.com that you can actually go to and look into kind of what's available for these patient assistance programs. And better yet, you can ask your pharmacist, you can ask your doctor's office if they're aware of any for the certain prescription that is causing you a lot of grief and costing you a lot of money. Patient assistance programs can be a little bit extensive in terms of the process of applying for them, but they can be certainly worth it. And we've had clients of ours save thousands of dollars over the course of the year on certain medications with patient assistance programs. The second thing that you can look at is ordering prescriptions from Canada. Okay, so if you have a Canadian pharmacy that you can actually work with, there's one online that we actually recently made a video about walking you through how to use it, and it's called mapleleafmeds.com. Okay, now I am by no means a pharmacist, a licensed provider, a licensed healthcare professional of any kind, so please take that with a grain of salt. Make sure to consult your doctor and your doctor's office before you order foreign prescriptions. But however, what we have found is you can go onto that website, and even if your prescription cost is very high, you might be able to order it at a cash price off of a website like Maple Leaf Meds. You typically have to supply and show a prescription in order to be able to order the medication, but sometimes the cost of the medication at the cash price is far lower on a website like Maple Leaf Meds than it might even be with your insurance, right? So you can always check out a website like Maple Leaf Meds or other Canadian-based online pharmacies and see if you can order your prescriptions there for a lower cost. The third and final thing you can kind of look at is free coupons. Now, this one is typically not as effective as the first 2, but it can lower the cost of certain prescriptions. So if you're looking at a coupon service like a GoodRx or a Simple Care, which is another very well-known online coupon service for prescription drugs, there's plenty of them out there, but sometimes you can kind of compare the cost of the prescription getting it with a free coupon. And now every major pharmacy in America typically takes these coupons, especially GoodRx, and you can compare the price. Now, one thing that you can't do that you need to be aware of is you cannot use your insurance to get the cost down on a prescription and then use the coupon in addition to that. It has to be one or the other. The coupons are usually looked at as an alternative to insurance. It's something usually designed for people that don't have insurance, but you can certainly use it if you have insurance, but you can't use it with your insurance. It has to be one or the other, okay? So let's say your prescription is $100 a month with your copay with your Medicare prescription drug plan Part D benefit, right? And you can get it through GoodRx or some other kind of coupon service for $70 a month. That's a better deal than running it through your insurance. So sometimes going on these free tools, seeing if you can get a free coupon online. You can get an app on your phone. You can print them off on your printer, bring them into the pharmacy. There's a lot of different ways you can kind of do this, but you can compare and contrast. See what you're paying currently for your prescription with your Medicare prescription drug benefit. Compare it with what it could be through a coupon. See which one's lower, and you might be able to get some savings in the process by using some of these free coupons. Hey folks, what did you think about these 3 alternatives to get your prescription drug costs lower? Were they helpful? Were they not helpful? We'd love to hear your feedback. Comment down in the comment section of this video what you thought about these 3 methods. If they were helpful, if they were not helpful, or something you knew, something you already knew, something that you learned. Make sure to press the like button, that thumbs up button on this video. It actually helps more people come across this video in the YouTube search, and it might dramatically change their situation. They might need to see this information. Make sure to subscribe. We put out Medicare videos consistently to help you get the best out of your healthcare and your Medicare. Without further ado, thanks so much for watching. We'll see you next time. Thanks, everybody.